There are a number of antidepressants that do not fit neatly into the other classes we've covered so far. We've seen the SSRIs, SNRIs, tricyclics, MAO inhibitors, but then there's this special set of agents called the atypical antidepressants, which will be the focus of this sketch. In addition, we'll mention one agent that's in its own class of serotonin modulators. These drugs are frequently used in patients with major depression who have had inadequate responses or intolerable side effects with another first-line treatment. Because of their efficacy and tolerability, SSRIs are considered your first-line agents for initial treatment of unipolar major depression. Yeah, the atypical antidepressants and serotonin modulators are often relegated to benchwarmer status. However, these agents have some pretty unique properties as well, bumping them up to first line when a patient is looking for certain desirable characteristics. So instead of benchwarmers, think of these agents more as a sixth man, or in this sketch, sixth woman. She starts on the bench, sure, but if you're looking for that extra passing play late in the game, or more likely, if you need to say, help someone stop smoking, or you're in need of reduced sexual side effects, then put these agents in the game. Let's start with the atypical antidepressants. And because these are pro ball players, I'd like to introduce bupropion. Whenever you think of treating depression, I want you to think of enhancing the synaptic availability of monoamines. Just think of our SSRI and SNRI sitcom sketch where we described how these drugs treat depression and anxiety by inhibiting serotonin and norepinephrine reuptake, thereby increasing monoamine availability in the CNS. Bupropion is an antidepressant drug with a chemical structure similar to that of amphetamines that works by inhibiting the reuptake of norepinephrine and dopamine, hence the new slogan of the Women's Pro Basketball Association, Net Dat Ball Pro. NET stands for the norepinephrine transporter responsible for the presynaptic reuptake of norepinephrine from the synapse. DAT stands for the dopamine transporter responsible for the reuptake of dopamine. So, as these pro ballers net dat ball, remember that bupropion antagonizes the effects of these two transporters and increases the synaptic levels of norepinephrine and dopamine. And I just want to emphasize that unlike the previous antidepressants that we encountered, bupropion has no effect on serotonin. No smiley faces here. Because bupropion resembles amphetamine in chemical structure, it exerts CNS activating effects. This makes bupropion useful in treating depression associated with hypersomnolence and low energy. Similarly, this ecstatic courtside season ticket holder shouts in his bullhorn in celebration of the game-winning shot. A boom! Shakalaka! His jubilation has aroused his friend from somnolence as well as arousing his memories of the 90s, which is likely the last time anyone had used the phrase boom shakalaka. Bupropion can also be used to treat tobacco dependence. Just look at the inspirational message for all you teens out there brought to you by the Women's Pro Basketball Association. Pros don't smoke. It's not clear why bupropion reduces the urge to smoke. Nonetheless, it seems to be about as effective as nicotine patches. Keep this in mind when your patient comes in seeking treatment for depressive symptoms as well as nicotine dependence, though other antidepressants may also have a role in the treatment of smoking cessation. The most significant side effect of bupropion to watch out for is seizures. So, as this power forward slams the ball into dat net, she clings to the rim in an extravagant act of showmanship and shakes uncontrollably. Seizures are even more common when bupropion is given at high doses and should be avoided in any patients with a history of seizures. The risk of seizures is also greater in patients with a pre-existing eating disorder. See how this towering center forward boxes out her two opponents? One of them looks like she was caught off guard while munching on that binge-sized snack. The idea of binge eating, of course, should remind you of bulimia. The other player looks quite gaunt from years of over-exercising and under-eating, and her BMI is definitely under 18.5. She should remind you of anorexia nervosa. So, as they hit the hardwood surrounded by those sketchy seizure shadows, remember that bupropion is contraindicated in patients with a history of bulimia and anorexia nervosa because it lowers the seizure threshold in these patients. Bupropion is therefore contraindicated in patients with seizure disorders or current or prior diagnosis of bulimia or anorexia nervosa. Remember, bupropion is not your typical antidepressant. And it actually has a few added benefits that make it the preferred agent for treating major depression in certain patients. First of all, remember that bupropion is different than the other antidepressants in that it doesn't affect serotonin. And unlike agents such as SSRIs, bupropion does not cause sexual dysfunction. Score! This is depicted by this young couple locking lips under the basket after the game-winning shot. Get a room. Remember that SSRIs can cause sexual side effects in up to 50% of patients. And if your patient is distressed by a significant decrease in libido or impaired sexual performance, consider transitioning to bupropion instead. Lastly, bupropion may also be preferred because it causes less weight gain than other antidepressants. So check out our last public service announcement meant to inspire all those kids out there playing NBA Jam on their SNES to get off their duffs and stay fit. It turns out that bupropion can help with weight maintenance, or it can even be associated with mild weight loss. Alright, the next atypical antidepressant to introduce is mirtazapine. If you recall, mirtazapine is the alpha-2 blocker featured on the wall of the opera house haunted by the Phantom of the Alpha. And in that scene, the name mirtazapine was embodied by the phrase mirth and misery. Here, the same saying mirth and misery adorns the screen on the Jumbotron. At Sketchy, whenever we talk about the treatment of depression, we'll include a symbol like this one, the sad mask to remind you of the negative symptoms associated with major depressive disorder, and the happy mask to emphasize the goal of treatment, which is remission of all symptoms. Mirtazapine's ability to block presynaptic alpha-2 receptors is represented by the extinguished double alpha candle. In this scene, we've updated it a bit, depicting instead two alpha-shaped filaments that are out. Inhibition of the presynaptic alpha-2 autoreceptor causes an increase in presynaptic catecholamine release. This is represented here by a celebratory release of balloons covered with serotonin smiley faces and norepinephrine north compass points. Mirtazapine's pharmacology is actually quite complex, and the receptors affected by this drug don't stop there. See these retired jerseys hanging from the rafters? One was worn by the great Buck Williams, number 52, the other by the acclaimed, nay, worshipped, Artis Gilmore, number 53. Let these inactivated numbers represent mirtazapine's additional ability to antagonize 5-HT2 and 5-HT3 serotonin receptors, respectively. Mirtazapine is also a potent H1 histamine receptor antagonist. So, in that private box up there, the head caterer can be seen wielding a beeswater, a recurring Sketchy symbol for antihistamine action. As you might have guessed, this antagonism at the H1 histamine receptor can cause sedation, which is depicted by our sleeping fan here who lost interest about halfway through the match. You know, some people come for love of the game. This guy, though, came for love of whatever that pink stuff is in front of him. This side effect can actually be used therapeutically, making mirtazapine one of the first-line options for patients with major depression and insomnia. Mirtazapine can also be used as an adjunctive treatment with the more activating antidepressants like bupropion to balance out the effect. Notice, too, that our private booth patron is also looking quite rotund from the long season of exorbitant dinners. Unlike bupropion, mirtazapine is associated with weight gain. Though it's often an unwanted side effect, this too may be desirable for some patients, including the elderly or patients with major depression and anorexia. Like bupropion, mirtazapine may be preferred as a first-line treatment for major depression because of its lack of sexual side effects. And next to the mirth and misery cam, we've got the kiss cam, featuring our sexually active and presumably fully functional lovebirds. Seriously, that is disgusting. Go get a room. Alright, it's time to introduce our last agent, which has a slightly different mechanism than the other antidepressants in this chapter. Say hello to trazodone, signified by the overzealous trombone player from the local college band who rushes the court after the supposed game-winning shot. Careful, Gary, you remember what happened last time? You rushed the field too early with that trombone of yours when Stanford supposedly won? Can we wait for the official whistle this time? Trazodone is a serotonin modulator. In other words, it antagonizes postsynaptic serotonin receptors while also weakly inhibiting serotonin reuptake, and I don't know, it gets a little wishy-washy from there, but trazodone's various effects on serotonin will be represented here by the drummer modulating the tempo of serotonin with his big smiley face drum. Trazodone specifically antagonizes 5-HT2 receptors, so as a little extra reminder, our serotonin-modulating drummer here wears the revered, inactive 52 jersey. Signed by Buck Williams himself. I want to emphasize here that trazodone has minimal effects on norepinephrine and dopamine, so let's keep that band away from .net on the other side of the court. I'm looking at you, Gary. Stanford still remembers, Gary. Trazodone does, however, antagonize alpha-1 receptors as indicated by the celebratory lighter that has been extinguished by the blast from that trombone. Notice that the extinguished wick forms the shape of an alpha, a recurring sketchy symbol for alpha-1 blockade. As we know, alpha-1 blockade can cause major vasodilation, which leads to a rare but serious effect of trazodone therapy, priapism. Priapism is a persistent erection lasting more than 4 hours that is not associated with sexual excitement. Let the firmly erect trombone remind you of this side effect, as well as the nickname for this drug, trazobone. Priapism is most common in young adult men, and it is a medical emergency that can result in permanent damage to penile tissue and erectile dysfunction if left untreated. Furthermore, trazodone should be used with caution in patients with conditions that predispose to priapism, such as sickle cell disease and multiple myeloma. Another side effect of alpha-1 antagonism is postural hypotension. And here we see the coach of the opposing team has passed out in disbelief that his championship dreams are over. He looks pretty old too though, so I might ask about chest pain or something, just to be safe. Trazodone is also a potent H1 histamine receptor antagonist, and the ensuing sedating effects of trazodone can actually be quite pronounced. We saved trazodone for last because it is not a first-line treatment for depression, having been supplanted by the SSRIs. Rather, because of its hypnotic effects, its main therapeutic benefit is for patients with insomnia and major depression. And, as you can see, the opposing team just didn't have enough gas in the tank. I mean, they are completely out. Just look at them. We've also included our recurring antihistamine B-swatter, just for good measure. Because of its sedative effects, trazodone should be avoided in the elderly and should not be used with other CNS depressants, including benzodiazepines and barbiturates. Trazodone is a sedating antidepressant most often used as a hypnotic to treat insomnia associated with depression or with antidepressant treatment. Although it is less common than with the other antidepressants that affect serotonin like SSRIs, trazodone can cause sexual dysfunction. So we've included one last precocious band member leaning in for a kiss from that point guard and getting promptly rejected. Come on, son, you're out of your league. The last adverse effect of trazodone to mention is serotonin syndrome. It's represented here by the rack of balls tipped over as the band rushes the court, causing a noticeable buildup of serotonin smiley faces. Recall that the other drugs inhibiting serotonin uptake, such as SSRIs, SNRIs, and TCAs, were also associated with serotonin syndrome, and the weak inhibition of serotonin reuptake with trazodone means we should keep this side effect in mind here too. Check out our SSRI sitcom for more details about the specific symptoms and management options. Alright, I think I hear the final whistle. Let's do a brief recap. Bupropion is an atypical antidepressant that inhibits the reuptake of norepinephrine and dopamine. Net dat ball, pro! Increased norepinephrine means it can be stimulating, so it's useful for treating depression associated with hypersomnolence. Boom shakalaka! It can also be used to treat tobacco dependence. Pros don't smoke. Watch out for seizures, especially in patients with eating disorders. Unlike the SSRIs, bupropion does not cause sexual dysfunction. Score! And it's even associated with weight loss. Mirtazapine is another atypical antidepressant represented by the mirth and misery up on the jumbotron. It's an alpha-2 antagonist that causes an increase in catecholamine release, including norepinephrine and serotonin. Side effects result from H1 histamine receptors leading to sedation, though this can be useful for treating patients with depression and insomnia. It's also associated with weight gain, though this too may be desirable in patients with major depression and anorexia. Also, take a look at that kiss cam. No sexual dysfunction here. Lastly, trazodone, or should I say trazobone, the serotonin modulator. That's why this drummer is modulating that serotonin smiley face drum. It also antagonizes alpha-1 receptors. This leads to the rare but serious trazobone priapism as well as postural hypotension. And just look at those players on the bench. It can also be quite sedating because of potent H1 antihistamine effect. Useful for treating patients with major depression and insomnia. Remember though, trazobone is associated with sexual dysfunction. You're out of your league, son. And remember, any drug that inhibits the reuptake of serotonin can cause serotonin